you doing?
I'm checking it.
I'm a celebrity, that's why.
All right, so now look. Remember when we shook the hand? What did we do? We assessed for muscle strength and also for the temperature of the skin. Now, you already said that you're going to be asking him some questions, and he said okay. So now, what is your name?
James.
And why are you here today?
I'm sick, maybe.
Okay, and so where are you?
The bed.
He might not be too oriented. So now say for instance, you're at Weiss Memorial Hospital.
Okay.
And the person says, I'm at Weiss Memorial Hospital. I'm here for a head to toe assessment. I've been coughing up blood. If they say, I'm at the beauty shop to get my nails done, they are not oriented. Mm-hmm. So now you ask him a question that everybody ought to know. Who's the president of the United States?
Obama.
All right, so now you have established mental status. They are alert. They know current events, so you've established that. Now, the next thing that you are going to do is that you're going to start from the head. So you're going to take the scalp and you're going to look at it and you are palpating for lumps or bumps. So that's the head. What's next? The eyes.
H-E-E-N-T.
H-E-E-N-T. So remember to pick the pen light up like you know how to use it. Like this. Not like this. Like this. All right. So now take off your glasses. Remember, 4 cranial nerves have to do with vision. The first one is the Snellen chart. Cranial nerve 2. Mm-hmm. All right. So now you're going to do 3 exams. This is the first one. You're going to do Perla. So you ask them to look at an object. So look straight ahead. Look straight ahead. Okay. You take the pen light and you shine right on the pupil until you see a response. Then you come over here. You shine right on the pupil until you see a response. Now that's Perla, and that's also some cranial nerves. 3 and 4. Now, you got 2 other tests that you're going to do. You're going to do accommodation where it's going to be, you're going to ask them to follow an object. So, you're going to start out with it here, and you're going to go like this, and then like that. The pupils converge. The pupils converge. All right. Next, 6 fields of gaze. Cranial nerves, 3 and 6. 3 and 6. So this is what you're going to do. Follow the object. So remember, that's oculomotor, adducent, right? So you got 4 cranial nerves that have to do with vision. You're going to be saying what 4 they are, and you're going to be naming them. All right. So now, what's next? Oh, I forgot to get my, somebody look in the shelf right to the left, right on the bottom, and get me the tuning fork. Step in there, look to the left, down, and get the tuning fork. Thank you. So now, this is the ears, right? So you're going to be doing 2 tests. What cranial nerve are you testing for? For hearing. Lord have mercy. I ain't asked you the name of no test. I asked you the name of the cranial nerves. Is it 8? So you're going to do Weber. Then you're going to do either Renee or Ryan, and you're going to do this. Cranial nerve 8. Cranial nerve 8. So in addition to you doing these particular tests, remember too, you're going to be looking at the ears. Looking for any drainage. If they're an old person, you're going to be looking for any coarse hairs, because coarse hairs interfere with hearing. Now, what's next? Next, nose. We're going to do the nose. Cranial nerve. Number one. Cranial nerve number one. So basically, we're going to use the pen light, and we're going to be looking inside, and we're looking for patency. Open. And you might ask them if you're having any troubles, any stuffy nose, any drainage, any blah, 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 whatever. Now, remember we're looking at the face. We got 2 cranial nerves have to do with the face. What are they? 5 and 7. 5 and 7. And so to elicit that, you just ask them maybe to smile or grimace. Yeah. So 5 and 7. Remember, is it 5? That's 2/3 cranial nerve have to do with the tongue, taste. All right. Next, now we look into the throat. What I do with my pen light?
It's on the side of the page.
Okay. So now we're looking in the mouth. We ask them to say ah, and we are looking at the uvula to move. Yes. Asking them to stick the tongue out. Cranial nerve. When you got cranial nerve damage, you can't stick out the tongue. So now, in the mouth, you got cranial nerves, and 9, 10, and 12 all have to do with swallowing. Swallowing, speech. Yes? All right. What's 11? Spinal accessory. How do you elicit it? Shrugging the shoulders. Now, cranial nerves 1 through 12. And you notice on the sheet that there's a separate space for them, meaning that you're going to need to know all of them. Cranial nerves 1 through 12. You need to know. All right. Now, lymph nodes. So remember, the lymph nodes are back here. They start all the way from back here, go all the way down, under the arms and around the breast. We ain't doing no breasts. So we're doing like this. It's a rolling. Why are you moving? Rolling type motion. And it's rolling all the way out here. So that's for a lymph nodes. Now, we through with the head, are we not? Mm-hmm. All right, now, the other thing that you could do here if you wanted, you could palpate the carotid. So you could do your pulses up here now. So you could do the carotid, you could do this, and you could do this. So you're going to do 1, 2, 3. The others you're going to do after the abdominal assessment when they're laying down. All right, so now you're finished with the head. You did all of your upper peripheral pulses, right? Next, remember we said anterior. So we are going to do the heart first. Now, you are going to take the stethoscope and you are going to put it, what's this? Aorta, pulmonic, tricuspid, mitral, apical pulse. All right, so that's what you're going to be doing. You're going to be taking the stethoscope and you're going to be listening. Okay, now, so the aortic, what's the tomographic landmarks? Tomographic landmarks for the aorta. Is it the right second intercostal second space? Right second intercostal space. Pulmonic is what? Left second intercostal space. Tricuspid, third intercostal space. Mitral, fourth. And fifth. What's everything that you say for the apical pulse? No, that's not where you start. It's at the fifth intercostal space at the mid-clavicular line at the point of maximum impulse. Thank you very much. What medication do you use when you always check the apical pulse?
Digoxin.
Digoxin. Yes?
Yes.
Yes?
Yes.
All right. What are the perimeters for administering Lanoxin?
What are
The perimeters.
for administering? You have to
talk like a nurse, speak like a nurse, think like a nurse. If it's less than 60, you hold, you don't administer. Those are the perimeters, are they not? Or sometimes they might say the guidelines. You hold if it's below 60. Now, that was cardiac. This is respiratory. You are going to take the stethoscope and you are going to auscultate for normal breath sounds. You're going to use the bell of the stethoscope. You're going to put it on top of the trachea and you're going to listen. Then you're going to put it to the left and to the right. That's bronchial. Next, bronchiovesicular, located here in this area to the left and the right of the sternum. So that's where you're going to be using now the diaphragm. So you're going to be listening here and you're going to be listening here. Next, you are going to listen to vesicular. Vesicular all the way up here where the clavicle is. So you're going to start listening here, 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 all the way down. Now all of that is normal. Normal. So now we go posterior. So stand up and turn around. Posterior. Remember, we're going to have them fold their hands so that the scapula flattens out. You're going to take the stethoscope, and remember, we're going to go in between here. So we're going to be listening. Take a deep breath. Listening here. Here. And this is the pattern. This is the pattern because remember, we are comparing from side to side. What we hear over here, we're comparing to what we hear over here. What we hear here and here. That's the pattern. Next, you are going to percuss. Remember in the book, it say one finger. Females use two because our hands are smaller. Males use one finger. So, these fingers are up. These fingers are down. It's a snapping motion of the wrist. So, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. You are comparing what you hear from side to side. Next, what you do back here, thoracic expansion. You're going to put your hands here and tell them to take a deep breath, and you should see the thumbs move up, breathe in and out. Take a deep breath, in and out. And your hands, your thumbs, should be moving equally back here. Now, you back here. Now, spinal. Can you lean forward? Now, so now what you're doing, you're looking for a nice, smooth spine, and you need to be able to say what are the 3 deviations that you're looking for. And they are kyphosis, not hump on the back. Kyphosis, lordosis, and scoliosis, and you need to give the definition for what they mean. So what is kyphosis? Kyphosis is a curvature of the thoracic spine. That's what you need to say. All right, we threw back here. Now lay down. Now the other thing that I forgot too is when you start out with the neck, remember you're giving range of motion. So range of motion, just looking to the left, looking to the right. So that's all you're doing for range of motion. Now, to perform an abdominal assessment, you get down level and look at the abdomen. You are looking for the contour or the shape of the abdomen. The contour or the shape of the abdomen. And remember, we are going to be doing this next to skin, not on top of clothes. All right, so the first thing we're going to do, we're going to auscultate the abdomen and out for a quadrant starting over the cecum. And you're going to listen until you hear vowel sounds. So you gently put it there. You listen. All right, one of these came off.
Yeah.
There it is behind the wheel.
Yeah.
Right there. It's a clear plastic piece. I think when this part came off. Lord have mercy. Well, I'm not going to put it in my ears. I'm like, something is not right here. All right, anyway. you're gonna listen until you hear vowel sounds. Then you're gonna move up. Then you're gonna move over. Then you're gonna move down. Well, you can. All right, now, the next thing you're gonna do, you're gonna percuss. You're gonna percuss. All right, so now, remember percussion? You like this. So did you hear the way that it sounded different over here? That's because of the sigmoid colon. Possibly, it's got some stool to carry down to the rectum. Next, you are going to palpate, and you're going to use just one hand. So you're like this. This is palpating. And he is making his abdomen tight. So remember, the doctor is trying to feel something. Now, the next thing you're going to do, you're going to have the person to palpate their own femoral artery. Palpate it is down in here. Hello. Feel it. You're going to actually palpate your own femoral artery.
So awkward.
Well, now, if you can't do it on yourself, how in the heck you going to do it on a real person?
I'm doing now.
All right, so now remember, too, the other thing that I told you. On thin people, sometimes you can relax your abdomen.
It's so ticklish.
Here I am palpating his artery, his aorta. Do you feel me palpating it?
Yeah.
So on thin people, this is where the aorta would be, and I can actually palpate his. What were the other arteries that's in the abdomen? Renal. You got 2 renal arteries. You got 2 iliac arteries, and you got 2 femoral arteries. Remember, they on the side, and then you got the aorta in the middle. So remember, the reason that we are looking and assessing the abdomen too is because we can have some visible pulsations. That's not normal, right? Mm-hmm. That's an aneurysm. So that's one of the reasons that you got that in your head when you're looking at the abdomen and you see some pulsations. That's not normal. Now, we did the femoral. Now we come on down here. This is how the doctor actually palpates the popliteal. In here, it's like in a crease. Do you feel me palpating it? Yeah, it's right here. So that's the popliteal. Now, go up here on top of the foot, the toe, draw a line. Right up on the top is where the dorsalis pedis should be.
Right at the instep.
Right there, yeah. And then here, right here where this bone is, right in the crease is where you should be able to palpate another one. Next, you do range of motion. You flex the knee. Boom. You do flexion of the hip all the way up. All right, that's what you're going to be doing. And you're going to be doing this. Okay, now, if I ask you a question about dorsiflexing the foot, he dorsiflexes it and he has pain. What is that indication of? What's the name of the sign?
Homan sign.
Homan sign. So when you dorsiflex the foot and you get pain in the calf, that's called a positive Homan sign. A positive Homan sign is indicative of deep vein thrombosis or glomerulophlebitis. That's it. That's what you're going to be doing. Plus, I'm going to be asking you some questions. All right, so remember now, I'm going to be asking you some questions too, baby, about love dub. Boom, 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 boom. S1, S2. Where you hear S2 at?
At the aorta.
So it's up here, and then S1 is her best down here. And so what's happening with S2? What's happening?
And
It's the opening and closing of the aortic and the pulmonic. And down here, yeah, right. So remember, you're using the mnemonic apartment M, but I don't want to hear you tell me apartment M. Apartment M is for you to remember. Aortic, pulmonic, tricuspid, mitral. Got it? All right, so that's what we doing. Bump, bump, bump.